on. That one can be used to debride. It adds moisture, but oddly enough, it can also help dry out a wound if it's too wet. So that one gets a little more confusing, but I just throw it out there because we're kind of fond of it in the home care setting and use it a lot. The hydrating products we talked about are Hydrogel and MediHoney Gel. There's moisture barrier ointments such as Vaseline, Aquaphor, and also A&D ointment. And then there are products like Vaseline Gauze that will add moisture to a dry wound. And then lastly, often you'll see us trying to debride a wound, and so one of the things we're fond of in home care is calcium alginate and foam for what we call autolytic debridement. That is just a way of saying that we are encouraging the body to rid itself of the dead, devitalized tissue. Hopefully the calcium alginate moistens it up a little, maybe sticks to it a little, and when you take the dressing off, that dead, devitalized tissue will come off. Santal is a prescriptive ointment that is put on the wound to try and encourage sort of the Pac-Man product. It'll kind of eat away at the dead, devitalized tissue. And then the Triad we talked about will help with debridement. It has like little debridement granules in it. So that is a quick primer on talking about like some different treatments, talking about how to measure wounds, talking about how to assess wounds. Sharon, I think we had a couple more pictures we could show them as well. So this is sort of a schematic representation of different pressure injuries, stage 1, stage 2, 3, and 4. And so one of the things that I like to point out to people to give them an idea of how you identify them is, remember, stage 1 is always intact tissue. If there's a break in the skin, it's not a stage 1. Stage 2 is probably a scratch and beyond, but you haven't gone through all the layers of tissue. If you have slough or any of that dead, devitalized tissue that I spoke of, then it's at least a stage 3. And if you can see bone or muscle in it, then it's at least then it is a stage 4. It's not at least, it is a stage 4. So those are some quick little primers. If it's intact, it's a stage 1. If there's a break in the skin, it's at least a stage 2. If there's slough present, then it's at least a stage 3. And if you can see or feel bone, it's a stage 4. So this is talking about deep tissue injury and unstageable. And basically the difference between those is deep tissue injury is going to be intact skin, but it's going to have a dark purple, almost maroon sort of color. On people of color, it will definitely be more purple looking. It doesn't blanch when you press on it and try to take the color out of it. It doesn't go away. It stays that dark, deep purple kind of maroon. It's basically telling you that something's been going on under there for a long time, and it's highly likely that that tissue will open up at some point. Unstageable is covered by like that thick, black, leathery eschar that we talked about, or it has so much dead, devitalized tissue in it that you are unable to see the base of the wound and actually know what you're dealing with. So if you can't see at least 40% of the wound, then you probably want to term it unstageable because you don't really know what's under there. And that, I tell people, think of it like a core. When all that dead, devitalized tissue comes out, you could have a really big hole under there. So that's why it's best to just call that unstageable. So that's basically the quick primer on the wounds. Do we have a few minutes then to go over the check yourself questions or no? Sure? Okay. So I came up with some questions that will help you decide if you got what you needed to get out of this and if we met the objectives. We want to talk about 3 steps in wound assessment. We talked about assessing the drainage, we talked about odor, and we talked about the color of the wound. So those are three right there when you're assessing a wound. We talked about the correct order for wound measurement. You want to go top to bottom, or 12 o'clock to 6 o'clock, head to toe for the length. Then you want to do the width, side to side or hip to hip, and then you want to do the depth. And the reason for that also is that that's a universal protocol then. I can look at any measurement and know that I'm looking at the length first, the width second, and then the depth. And then as a byline, you would make the tunneling or the undermining information part of your note. So then what you also want to do is talk about the type of tissue that you're seeing in the wound, and we talked about measuring that in terms of percentage. So for instance, if you were, can we back up to that other one? I think there was one was, yeah. So right here, for instance, on this one on the right-hand side, I would look at that and I would say that is 50% beefy red and 50% yellow slough. Because that's about 50-50 of that wound. So that's an example of how you look at a wound and identify what colors you're seeing in it. So then one of the other things we talked about was an example of a hydrating product. So we can throw some of those out, like hydrogel, Vaseline gauze, a silver gel, and then we also talked about what we call moisture barrier ointments, such as Vaseline, Aquaphor, or A&D ointment. We want to talk about two absorptive products. So if you can take a second and think about that, you'll remember that we talked about calcium alginate being a highly absorptive product, and we talked about the fancy baked on in the factory gauze with saline in it, and that is Mesol. So those are two examples. If you have a really wet wound, those are two good choices to try to dry it up. If you have a really dry wound, the ones we talked about a few moments ago, the hydrogel, the silver gel, Vaseline gauze, those types of products will add moisture to the wound. And then lastly, I wanted to see if you could name one debridement product. So I'll give you a second to think about it. So we talked about Santal, which is an enzymatic debrider, kind of like Pac-Man. You put that ointment in the wound, nickel thick, and it sort of eats away at the dead, devitalized tissue. And then we also talked about we talked about Meta-Honey can be used as a debrider. We talked about Triad as a debrider. So those are some examples of debriding type products. So in summary, we talked about the importance of assessing the wound. We talked about what are some signs where it might be infected and what are some signs when it's not infected. We talked about some products which might make you think that there's an infection because of a funny odor or a funny color. We talked about how to accurately measure a wound, and that it should be done once a week at the first visit of the week. And then we also talked about some different products, and we talked about the fact that if a wound is wet, we want to help dry it out. If it's dry, we want to add moisture. And if it has a lot of dead, devitalized tissue, then we need to debride it. And so that's some of the criteria that we use for our product selection. I hope this quick little primer was helpful for you. All of us in the WOC Mobile Wound Group are always available for questions. We're always available to take your calls. So you can jot mine down right now in case you don't have your list. 216-404-6465. Give me a call if you have questions. Thank you.
Your name?
Joni Paris. I told them at the beginning.